Hello, everybody, and welcome back to another episode of Trading Brains. I'm your host, Evan Greif, here with my co-host, Angelo Messina. Thanks for joining us today. If you're already a listener and you like the podcast, please leave a comment and subscribe to us on YouTube. Our links will be in the show notes for this episode. If you have any comments or content suggestions, feel free to reach out to us at tradingbrainspodcast@gmail.com. Again, that's tradingbrainspodcast@gmail.com. Or you can reach out to us at Trading Brains on social media, such as Twitter or Instagram. Today's episode is going to be another episode on coronavirus. And we're doing a second episode just because we feel like we didn't cover everything we wanted to cover last week. And also, there's been some new developments since that episode. And we're just going to catch everybody up on what's going on in terms of case numbers as well. So, Angelo, do you want to fill us in on what's going on in New York and possibly Italy?
Yeah. Well, hello, guys. Welcome back. As of right now, I'm using the GIS data map as a reference, and as of right now, confirmed cases is about 1,694,000, and that's around the world. It's getting crazy because another 70,000 cases around the world is being added. Almost 500K is just in the U.S. And it's shortly coming to being the most deaths in the country or around the world, and it has 18,545 just about. And it's only 300 behind Italy, which has 18,849 deaths. While Italy has that high death, it is going down, freeing more beds in the ICU. They're taking less in, as well as admissions going lower. So, like with the number of patients being hospitalized is going down by 160. And intensive care is about 108. That's freeing up about 260. About 260 beds in the hospital around the country. Yeah, that's a small number, but spread it out. The beds are free. So then,
right
now they could treat more. Ventilators not being split as much now, so people can get more attentive care too, and not trying to split everything. And that's a good sign.
Yeah. So when it was in Italy, you said like 18,000 deaths, just about. Was that more because people were getting it so quickly that doctors couldn't treat everybody at the same time, so they had to choose who was getting, intubated or who was getting ventilators and who wasn't?
It's definitely you have to pick your battles on who gets the ventilators and who doesn't.
Right.
With the ventilators, basically just you're kind of like putting them to into sleep and into stasis and you need one ventilator for one person, but what's going on that they're splitting it, so then it's going at 0.5%, like 50% for two people.
Okay.
And it's basically because they don't have enough ventilators.
Right.
So now they have to pick, okay, only if people in the sense of care, they get it, and then if they're on the verge, then they get it. You know what I mean? So now with more people are coming out and not enough coming in, that's a good sign. So now they're freeing up beds, freeing up nurses that can attend to more patients, just freeing up ventilators, and now people are getting the full 100%.
Yeah. And that's exactly what they mean by flatten the curve, right? Yeah. It's making sure that the admissions are not outpacing the healthcare facility's ability to react.
2,000 recovered in the 24-hour mark from today, so that was a good sign. So they have a total of 30,455 people recovered. So that's coming down to the end. That's about a fifth of the population that has it are being recovered. So that's a good sign in the sense of where it was before. Now, but instead of that, they just they went to the news and kind of like a State of the Union, and they extended the lockdown. as well as Prime Minister of Italy announced the extension of the lockdown. So, which is another good thing because it is working. People are getting better and they're being isolated. It's creating more family bonding. That's what everyone wants, but also it's getting away from the interaction from people only when you need food or not. So
or medicine too, right? I mean, if you have to go to the pharmacy, then...
of course. If you want to go for a walk, yeah, but mostly just stay at home, go on the balcony, get some fresh air, but trying to return a lot. If anyone has an app idea, basically delivering food, like Postmates and all that stuff, now's the time because people don't want to get out of the house and there's money to be made.
Yeah. Well, because there's the fees on getting delivery for Uber Eats or any of those sort of food delivery apps. So
it just came out of my head about that. Is it be a good idea to people start either go on it or try to develop an app like that because
right. Well, I mean, I don't know about developing an app like that because the market is already so saturated with these, players.
Mm-hmm.
But it's funny because Maya and I were actually thinking about ordering Uber Eats for this weekend. Yes, it's funny that we ended up on the topic.
That's what I'm saying. It's something right now you need it, so I feel like
I mean, we don't want to go to the supermarket and possibly become infected with COVID, and then if we get infected with COVID, then we have to try to stay away from each other and try not to go out even more than we already are right now.
So besides in America is, I still think with America how it is, we have to try to flatten. I know everyone's saying flatten the curve. Flatten the curve will come. I think we just have to weather out the storm. Be more active in the sense of your personal care and your family. If you're gonna go somewhere, let's just say a gas station, sanitize. Have sanitizers after you touch the pump, because that's a lot of germs that people are going through, and then they'll touch their face after, and that's a lot of people are not thinking about that because it's just so everyone uses it.
Yeah, it's such an everyday thing. You use a gas pump and whatever. I think it's really hard for people who already have a habit of touching their face. And granted, that's not a good habit to have, but it just is what it is. That's how human behavior is sometimes. So you have to be conscious of that.
Whatever the case, it's trying to urge it if you're going to touch something that someone may touch that you don't know.
Well, now, with COVID in my mind all the time, I'll go outside and I'll go to the supermarket and I'll touch some of the open air vegetables or whatever. And before I get home, I can feel I don't know, something dirty is on my hands. And I was just thinking oh, I can't do anything with these hands. Even when I open up the door to go into my apartment, I'll try to use my elbow or whatever, and then I'll go immediately to the sink to wash my hands.
So always have wear gloves if you're gonna go to the supermarket. Have gloves on, and then after when you bring it back home, desanitize everything. Use Lysol, whatever on the box, not your food, and wash your food, of course, after.
On the box, not your food.
Well, just in case.
Yeah, just in case,
So there's other development that the NIH, CDC, these are big government operations that are going on that are doing clinical trials, because now it's these drugs are being, from our last episode we talked about phase 1, phase 2, different kind of companies such as Regeneron.
Absolutely.
So there's a clinical trials with the NIH, is a government run facility that's using
the National Institute of Health.
Yes.
Okay.
And they're using a drug called hydrochloroquine. It's a potential therapy for COVID-19. And a fun fact about this one: this is used for patients that has malaria. They treat that, and also RA as well.
RA? Rheumatoid
arthritis. Rheumatoid arthritis. I was getting right after that. So with people are, as right now, they're trying to aim about 500 adults, and it's a placebo-controlled clinical trial. So some people may get the treatment, and some people might get a placebo. So just keep in mind when you go into these trials, you might get the placebo, and they won't tell you. You won't know if you got the drug or not.
Yeah, I mean, it's their job not to tell you, right? If it's a placebo, then
Because if someone's going to tell you like, hey, you're going to join this trial, but you're going to get a sugar pill.
Yeah.
No one's going to join. So
yeah,
if you want to go into, you're doing for the better. They're not going to put your health at risk. They're not going to get it. If you're about to die, they're not going to give it to you, but it's going to be as random as possible, though.
Wait, so they're giving it to a population of people who
are in intensive care.
Are in average health or like good health? What do you like?
I think it's going to be.
It's obviously dependent on your immunosystem, right?
Yeah, it's so like what I'm reading in the NIH right now. It is they're trying to get 500 adults that are currently hospitalized. So, in the sense of they are in not the great of shape because they're trying to keep all variables about 1 or 2. Like just you're in the hospital and you're either got the pill or you don't got the pill. That's what they're trying to see if the drug works. And
that makes sense. That's the most fair because like you can't be testing this on people who don't have the virus, right? You have to test it on people who have it. So it's
going to be randomized. So keep in mind that you might get it, you might get the drug, and you might not. But let's just say you do get the drug, it doesn't work. It's fine because then they could try to do the next drug or trying to figure out what's going on.
So if you're in the hospital, right, and you're tested positive for COVID and you're in a hospital bed, does a doctor or a nurse come up to you and say, hey, do you want to be a part of this trial?
So it depends on the position. It could be a research assistant. It could be a research coordinator. It could be a research nurse, doctor, whoever is running the trial or taking point on recruiting.
Okay.
That's going to be the point of contact of talking to you on recruitment. After that, it will be your doctor be talking about the update of your drugs, of the drug update or your cure or the trial throughout the trial.
Yeah.
So their goal is trying to enroll more than 500 adults. So that's closer to phase 2, phase 3.
Right.
And from what we talked about previously, if you haven't heard part 1 about the coronavirus, pause now, watch the first episode, and come back.
Yeah, and if you're watching live, then you can always go back to our first episode and all of our other episodes and like all of them and subscribe and comment.
And you're one of the few lucky ones are watching the live one.
Yeah, exactly.
So a couple like fun things that are going but when I say fun, it's like a little factual knowledge on COVID-19. And so with since they have no therapy going on, so all of these are clinicals, like these are potential therapies that could work in the United States that's going on.
Okay.
So right now the drug is demonstrated like an antiviral activity with the hydrochloroquine. So basically an antiviral, the main goal of it is basically to stop the replication of the virus. So your body, like why people get the symptoms is because your body's fighting the virus. And your virus is duplicating itself faster than your body's killing it off.
Yeah.
So with the drug, is basically in theory is trying to be that extra boost to cut off the leftover that are reproducing and to inhibit the RNA transcription. So the RNA transcription is the kind of like their DNA, their version of the DNA, our DNA.
What it does is like the virus will make a copy of its RNA. The purpose of the treatment, right, or the drug is to slow down that process of transcription.
Either slow down or stop it completely.
Okay, all right.
So it doesn't make another virus. And then,
right. I mean, I'm not expecting you to know all the details, but does it like make a completely like benign version of its own RNA
So
or?
basically, when the RNA is very unstable,
Uh-huh.
and why is unstable? Because it has one strand of nuclear acids, like
Right,
your
right.
A, C, G, T.
I
There's
remember in high school, yeah.
yes. So basically, when it goes, so it needs to replicate that, right?
Uh-huh.
So basically, the antiviral, like the inhibitor, will basically put a block on it and kind of like basically like Pac-Man will just chomp on it and bite it off, and it will just
Okay.
split, and then no,
Uh,
it cannot be a virus anymore.
right, it can't do anything. So then it has to replicate RNA
The
thing.
same
Okay.
sequence.
Right, right.
It's basically what's going on is just put it on a block, so you cannot make the full DNA. Like let's just say it's 10 blocks, it will
Yeah.
stop at 5 with the inhibitor, so it
Uh-huh.
only be able to make 5, and that's not the virus. So it
Right.
needs to make the full, or be like a virus, but it'd be like a really dumbed down version of that virus, and the
Yeah.
body
That
and
isn't
our
even
white
able
cells
to
or
replicate.
neutrophils will attack it, or white blood cells will attack that and
Okay.
destroy it.
Right, right, right. And then you build up immunity and blah 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 blah.
But
Is it valuable to have people who already have developed antibodies for COVID donate their plasma or
yes, and that's the
yeah.
next. That was I was actually going into after the
Okay.
other
Cool,
one.
cool. Sorry, got ahead.
That's fine. So like right now, like so like it's pretty cool about the drug because it treats for malaria and like RA, and it helps. So like how the treatment works is you get one dose of 500 milligrams, and
Okay.
of day one, and then after that you get 200 milligrams after that per day, once a day.
Oh, all right.
So you get the first big load rush into trying to stop, and after that they kind of like wean you off if you don't want to
Well, they
stay.
don't want to. They want to observe the effects, right?
Yeah, they want to
Yeah.
observe the long term effect, the short term first, and the long term after.
Yeah.
So that's why. Oh, sorry, not 500, it's 400 milligrams daily.
Okay.
Two
Oh,
doses.
daily.
Yeah, daily. So if one, then after day 5, then you get 200 milligrams twice a day. So they
Okay.
kind of like spread it out.
Okay. Yeah, yeah.
So
And the people who are placebo get just sugar pills.
twice a day.
Okay. Yeah.
So what another trial is going on, and a investigator is their investigation of this broad spectrum of antiviral activities
Mm-hmm.
called remdesivir. If I butchered it, I am sorry, but
That's difficult. I mean, we can put that in the show notes if
that's
they have
fine.
a link or like website. Yeah.
So what it does is, so this is basically trying to incorporate that with the malaria drug, the hydrochloroquine.
Mm-hmm.
And basically what this does, it's try to, and basically it's like, so is a virus. So they're trying to basically make it in the broad spectrum because all antivirals, the main purpose of it is to terminate the RNA transcription. But as in IV, it goes into your veins. So it's going to be included with your IV as well. So this will be basically going against the coronavirus through your blood, so it enters your bloodstream faster. While with the hydrochloroquine, you're taking that as a pill.
Wait, so you take the not the hydrochloroquine, the other one, the R, what is it called?
Remdesivir.
Remdesivir. You take that intravenously?
Yeah.
Oh, okay.
So they'll incorporate that with your IV, and that's basically that will be like a drip system.
Okay.
So basically going from the next thing that what you were talking about with plasma. So donate for if you are healthy and you have recovered
From
and you
corona.
have showed and you're negative for coronavirus, donate your plasma, donate your blood, but plasma because your antibodies will be in the plasma and that will give hope for other people to fight off. So they don't have the antibodies. So when you donate your plasma and they do a transfusion and basically inject plasma into another body, doing a transfusion. So they put your plasma into their body and recycle. So then they can reproduce those antibodies to fight off the virus. On top of, if let's just say they're in the clinical trial, they'll receive that as well.
Yeah.
Or if they want to keep the integrity, which mainly will happen, they won't give it to them because they want to understand if the treatment can work.
Yeah. They want to maintain the integrity of the studies, right?
So
but if
the people who
somebody
enrolled in those, they will receive the plasma, and it won't be like a clinical trial. It's more for if they're in intensive care and this is like last resort, that's what they're going to need.
Like, I mean, if it's life or death, whether or not they get this plasma, then I think they should get the plasma for sure, and I'm sure the healthcare workers and doctors would agree. I think that's so fascinating that you can do that in this day and age, like with human bodies, right? Like you have the plasma after you've contracted COVID, your body's fought it off, you have the antibodies now. Okay, your body just straight up reproduces that all the time in your plasma. And then you just take some of that out, put it in somebody else's body, and their body is just like, there's some new plasma here. Let me reproduce that. Like, it's crazy to think that our bodies can recognize it and just start reproducing it ourselves rather than, like, because you said it recycles, right? So rather than them, transfusing the plasma and then that new plasma gets recycled out and you don't actually produce the antibodies, your body actually learns from the new plasma and creates the same antibodies. That's so cool.
Yeah. So basically, your body will recognize the antibody because it basically will be of the same blood type that you will receive from. So your body doesn't attack it and think it's a foreign object like the coronavirus and fight on two fronts. So if you're the same blood type, they will accept it, and that will start reproduction of the antibodies and those plasma cells that have the antigens and the antibodies to start attacking the virus.
So if your blood type is O, like, you definitely should donate, right?
Yeah, because
I'm AB, so like I'm a universal recipient.
Yeah, you take everything.
Yeah, sorry.
Hold on, hey, it
is what it is.
You can't do nothing about it.
Yeah, that's true.
So, but yeah, so like when you have the chance, if you feel that you want to do something and help out, donate your blood, donate the plasma that you have to other people. There's always is a person in need for that. There's trying to put out next phases on these trials, and like,
do you have any drug that you're in the loop on about now that you think look promising, or it's too early to say?
I think with the high numbers that we are getting, it's still early, especially like we're not going to get the vaccine anytime soon.
Right.
That, to my knowledge, like I'm not like a doctor or anything to say like this is the case, but like what I am hypothesizing.
Yeah, that's fine, man. I mean, we're just.
I feel like more in the fact that these are new treatment that we are trying to fight it as fast as we can.
Yeah.
And there's some promise and stuff with the malaria drug because it has been being potentially better because now they're trying to enroll in 500, so they show some promising data. And with the plasma, that's also it is smart because it's basically giving the person who doesn't have the antibodies. And
that's such a natural remedy.
So,
I mean,
from
if you
those two that we are talking from this episode, I would rather choose the antibodies. Has it, just because that's not put in another drug that's basically treating for another, like it's treating for malaria while you're getting the antibodies for COVID-19.
Yeah.
And I feel like that one, it's a transfusion, so it's just basically recycling the blood, and as well as with the drugs, like this is all clinical trials, so some people can get it and some people won't get it. While the plasma donations, whoever needs it in that moment, and if they are the same blood type.
Right. Of course.
The only risk is which the doctors would do. They would see what blood type are you, and then from the donor, match it so your body doesn't reject it, and that'd be a big no-no.
Yeah, I mean, in general, that's outside of coronavirus, that's a big no-no. Yeah, so I mean, we really, really would appreciate, and I'm sure a lot of people's families and those who are affected by coronavirus, people who are infected, would appreciate any people who are out there listening right now. If you've had coronavirus and you've recovered, please consider donating your plasma. You would literally be saving lives, and you know,
not all heroes
say you can do that. Yeah, not all heroes wear capes. Like if you've been through that struggle and you have those antibodies, then you can save someone else's life. And if you save someone else's life, then that person can go on to do more great things and contribute to society and make our world a better place. So definitely, please do that.
Yet again, going back, thank you for all the nurses, doctors, respiratory therapists, lab workers, anyone that's in the healthcare field that's put in the extra hour, the extra 30 minutes, the extra
crazy hour.
Yeah. What's cool is going on, certain hospital, the local fire department at certain time of the day around like 7 p.m. will come out and block the streets and kind of like run their sirens and clap for the nurses who are coming out of their shift.
Right.
Putting a hard day of work and being a part of all that. That's really cool how everyone's interacting with each other and trying to give hope for everyone that we will beat this.
Yeah.
Weathering out the storm right now. One thing I do want to add is this has come in previous from like SARS, Ebola, Zika. And we all have passed this in the past. So won't be anything different than others. I feel like that this will come when it reached in the peaks of each country. That's that's the peak. It's only going to go down that point. So,
of course,
just be patient. Thank each other that you have the time with each other. Make the most out of it.
And do something like this. Like I feel like even one of my friends was mentioning it yesterday when I was Skyping with him that he's been in contact with people he hasn't talked to in years or months or a long time because there's a lot more free time to do video calls. So if there's somebody that you haven't been caught up on their lives, but you feel like you want to reach out to them, go for it. Do it because it'll be worth it. And you'll learn about what they're doing and you can catch them up on your life and. That's a great way to spend your time.
Pick up a new hobby.
That too, yeah.
And start something new if you have the time.
Yeah, build new habits. I think, read a lot. Actually, that's the best.
If you want to have the distraction, play video games. I know that we're just going off what we were talking about, but it is because of the coronavirus because everyone now is home. Or if you're an essential worker, you're working.
Yeah.
But there's something to keep your mind. I know a lot of people get stir crazy, so.
Yeah, it's interesting. Like when coronavirus is like absolutely, devastating New York and other places as well. Animal Crossing had just been released, and so many people just started playing that and were kind of hanging out at each other's places in that game. So. I thought it was interesting timing, not only, but a way to stay socially connected, even though we're social distancing. So, together alone.
Together alone. There we go.
Yeah.
But
or together. I don't know which one sounds better.
Together alone. Oh, let's go with together alone.
Yeah. All right.
For the sake of this, but I got nothing else to say, but just want to be safe out there. If someone you needs help, 1, donate your blood. 2, if you can't donate your blood, give a call. Be there for emotional support. Be a friend to everyone, and take care of yourself. If you go outside, wear gloves, wear a mask,
Yeah.
be 6 feet apart, wash your hands constantly, use Purell hand sanitizer, soap, anything that tries to fight yourself to try to affect other people.
Yeah.
If you want to catch for more future developments of this from Training Brains, follow us, subscribe us, let us know how we did on this episode and previously episodes. Like good or bad, either way is fine with us. We don't care. We just want to know feedback.
Yeah. Oh, well, I mean, we want good feedback, of course. Like, we'd love that, but bad feedback might be even better because we could learn from it and improve our podcast. So,
thank you guys again for listening to us, and we'll see you soon.
Yeah, we'll see you soon.
Have a great week, guys.
Yeah, see y'all next week. Bye-bye.
Bye.